Good evening, and welcome to a journey into one of history's most nightmarish professions. Tonight, we're stepping into the blood-soaked, superstition-riddled world of 17th century medicine, where doctors routinely killed more patients than they saved, where surgery was performed without anesthesia on kitchen tables by men who doubled as barbers, and where the very act of seeking medical help was often tantamount to signing your own death warrant. This is the story of physicians who prescribed mercury for madness, who believed that drilling holes in skulls could cure headaches, and who walked through plague-ravaged streets wearing leather bird masks filled with aromatic herbs, convinced they were protected by the power of scent alone. If you think modern healthcare is expensive, wait until you hear about a time when a doctor's visit might cost you everything, including your life. Before we dive into this medical horror show, drop a comment below and let me know what country you're watching from and what time it is where you are right now. I'm curious to know how many of you are brave enough to learn about amputation without anesthesia while eating your breakfast, or how many night owls are about to have their dreams haunted by stories of trepanation and bloodletting. The year is 1650, and you wake up in London with a splitting headache and a fever that makes your bones ache. In our modern world, you might pop an aspirin and call in sick. But in the 17th century, seeking medical attention meant entering a world so barbaric, so fundamentally misguided, and so utterly divorced from anything resembling scientific understanding that you'd be better off praying to whatever deity you favored and hoping for the best. The medical profession, if we can even call it that, was a nightmarish carnival of quackery, superstition, and well-intentioned torture that masqueraded as healing. To understand just how hellish it was to be a doctor in this era, we need to first grasp the complete absence of medical knowledge that we now take for granted. Germ theory wouldn't be accepted for another 2 centuries. Anesthesia was a fantasy. Antibiotics were unimaginable. The very concept of hygiene was not just ignored but actively scorned. Doctors believed that bathing was dangerous, that fresh air could kill you, and that the best way to treat most ailments was to make you bleed until you nearly died. The medical hierarchy of the 17th century was as rigid as it was ridiculous. At the top sat the physicians, university-educated gentlemen who rarely touched their patients and diagnosed ailments by examining urine, checking astrological charts, and debating the balance of the 4 humors: blood, phlegm, yellow, bile, and black bile. These men, and they were almost exclusively men, wore long robes and spoke in Latin, lending an air of authority to practices that were often completely useless at best, and lethally dangerous at worst. Below the physicians were the surgeons, who were considered crude craftsmen rather than learned professionals. Most surgeons were also barbers, which explains the iconic red and white striped barber pole, red for blood, white for bandages. These men performed amputations, tooth extractions, and various other procedures with the same tools they used to cut hair and shave beards. The smell of a barber surgeon's shop was a nauseating mixture of blood, pus, hair, and whatever alcohol was available to sterilize instruments, which typically meant giving the patient something to drink before the agony began at the bottom of this medical food chain were the apothecaries, who mixed herbs, minerals, and various animal parts into concoctions that were supposed to cure everything from lovesickness to the plague. Their shops were dark, cramped spaces filled with jars containing pickled organs, dried beetles, powdered unicorn horn, actually narwhal tusk, and other exotic ingredients that cost more than most people earned in a year. The irony was that many of these apothecaries with their focus on plants and natural remedies, actually provided more effective treatments than their more educated counterparts. Let's begin with what it was like to actually practice medicine in this era. Starting with the most basic and fundamental problem, no one had any idea what caused disease. The prevailing theory was that illness resulted from an imbalance in the four humors, a concept inherited from ancient Greek physician Galen and maintained with religious fervor for over 1,000 years. According to this theory, your body contained blood, which was hot and wet, phlegm, which was cold and wet, yellow bile, which was hot and dry, and black bile, which was cold and dry. When these were in perfect balance, you were healthy. When they were out of balance, you became sick. This sounds almost quaint until you realize that this theory directly led to treatments that killed thousands upon thousands of people. If you were diagnosed with having too much blood, which was blamed for everything from headaches to heart problems, the solution was bloodletting. And when I say bloodletting, I don't mean a small pinprick. I mean opening a vein and allowing pints of blood to drain out until the patient was pale, weak, and often unconscious. The tools of bloodletting were as varied as they were horrifying. The most common method involved using a sharp knife called a fleam to open a vein, usually in the arm or neck. The blood would pour into a bowl, and the doctor would watch carefully to determine when enough had been removed. Enough was often determined by the patient losing consciousness or the doctor deciding that the blood had changed color sufficiently. There was no understanding of blood volume, blood pressure, or the basic fact that removing large quantities of blood from a sick person was likely to make them much sicker or kill them outright. For those who preferred a less direct approach, there were leeches. Medical leeches were applied to various parts of the body, where they would attach themselves and suck blood until they were gorged and fell off. A single leech could consume up to 5 times its body weight in blood, and doctors would often apply dozens of them at once. The aftermath was a patient covered in bleeding wounds, weakened by blood loss, and often infected by bacteria from the leeches themselves. But bloodletting was just the beginning of the horror show. If you were unfortunate enough to be diagnosed with too much yellow bile, you'd be subjected to purging, violent induced vomiting, and diarrhea designed to rid your body of the excess humor. The medicines used for purging were toxic cocktails of mercury, antimony, and various plant extracts that caused such severe gastric distress that patients often died from dehydration and exhaustion, rather than whatever had brought them to the doctor in the first place. Mercury was particularly beloved by 17th century physicians, who prescribed it for an astounding variety of ailments: syphilis, depression, constipation, tooth problems. Mercury was the answer to everything. The fact that mercury is a deadly poison that causes tremors, kidney failure, and brain damage was either unknown or ignored. Patients who received mercury treatments often developed symptoms that were worse than their original complaints. But this was explained away as the medicine working to purge the body of disease. The phrase "mad as a hatter" comes from this era, when hat makers who used mercury in their trade developed neurological symptoms that resembled insanity. The diagnostic methods employed by 17th century doctors were as useless as they were elaborate. Uroscopy, the examination of urine, was considered one of the most important diagnostic tools. Doctors would spend hours studying the color, smell, and even taste of their patient's urine, consulting complex charts that supposedly revealed the inner workings of the body. A slightly yellow tint might indicate one imbalance, while a cloudy appearance suggested another. The fact that urine color is affected by hydration, diet, and dozens of other factors was completely lost on these practitioners. Pulse diagnosis was another cornerstone of medical practice, but not in any way that would be recognizable today. Doctors believed they could feel dozens of different types of pulses, each one revealing different information about the patient's condition. There were supposedly pulses that indicated lovesickness, pulses that revealed hidden pregnancies, and pulses that could predict the exact day a patient would die. The elaborate classifications of pulse types numbered in the hundreds, and physicians spent years learning to distinguish between them, all based on theories that had no basis in anatomy or physiology. Astrology played an enormous role in medical practice. Most physicians consulted astrological charts before making any major treatment decisions, believing that the position of the planets and stars directly influenced human health. Surgery could only be performed when the moon was in the correct phase, and certain treatments were forbidden during particular astrological configurations. This meant that patients with urgent conditions might have to wait days or weeks for the stars to align properly, often dying while their doctors consulted their charts. The actual treatments prescribed by 7th century doctors read like a catalogue of medieval torture methods. For headaches, trepanation was a popular option. This involved drilling or chiseling a hole directly into the patient's skull to release evil spirits or excess humors. The procedure was performed without any form of anesthesia, with the patient held down by assistants while the surgeon worked. Many patients died from the procedure itself, while others succumbed to the inevitable brain infections that followed. Cauterization was another favorite treatment, involving the application of red-hot iron rods to various parts of the body. This was believed to drive out disease by burning it away, and was used for everything from joint pain to mental illness. The smell of burning flesh was a common feature in medical establishments, and patient screams echoed through the halls as doctors applied their searing instruments with the confidence of men who believed they were performing life-saving procedures. For internal ailments, doctors prescribed concoctions that would make a modern toxicologist weep. Mithridate, supposedly the universal antidote to all poisons, contained over 60 ingredients, including viper's flesh, opium, and various heavy metals. Theriac, another popular cure-all, was made from over 100 different components and was so expensive that only the wealthy could afford it. Both of these medicines were essentially poison cocktails that probably killed more people than they helped. But they remained popular for centuries because they were complex, expensive, and had classical pedigree. The surgical practices of the era were perhaps the most horrifying aspect of 17th century medicine. Surgery was performed without anesthesia, using tools that were rarely cleaned between patients. The mortality rate for surgical procedures was astronomical. Amputation had a survival rate of perhaps 30%, and more complex operations were essentially death sentences with extra steps. A typical amputation would begin with the patient being held down by several strong men. The surgeon would use a saw to cut through the bone while the patient screamed and thrashed. There was no understanding of shock, blood loss, or infection control. The stump would be cauterized with a red-hot iron to stop the bleeding, causing even more agony. If the patient survived the procedure itself, they would likely die within days from infection or blood loss. Cataract surgery, if it can be called that, involved pushing the clouded lens into the back of the eye with a sharp needle. This was done while the patient was fully conscious, with their head held steady by assistants. The success rate was minimal, and most patients ended up completely blind rather than merely vision impaired. The treatment of wounds was guided by the theory of laudable pus, which held that the formation of pus in a wound was a good sign, indicating that the body was healing properly. Doctors would deliberately introduce foreign materials into wounds to encourage pus formation, often leading to severe infections that killed patients, who might have recovered with simple cleaning and bandaging. Obstetrics and gynecology were fields of particular horror. Childbirth was attended by midwives rather than doctors, which was probably fortunate for the mothers involved. When doctors did become involved in difficult births, their interventions often proved fatal. They would use crude forceps that frequently caused more damage than help, or employ various chemical interventions that poisoned both mother and child. The understanding of female anatomy was so poor that doctors believed women's organs, literally, wandered around inside their bodies. Wandering womb was considered a serious medical condition that could cause everything from hysteria to fainting spells. Treatments included fumigating the vagina with various aromatic substances to lure the womb back to its proper position. Mental illness was perhaps the most poorly understood and brutally treated category of ailment. Depression was thought to be caused by an excess of black bile, leading to treatments that included bloodletting, purging, and various forms of torture designed to shock the patient back to sanity. Melancholia patients were often confined in dark rooms, chained to walls, and subjected to treatments that would be considered torture by any modern standard. The daily working conditions for doctors were as grim as the treatments they provided. Medical schools, where they existed at all, were dingy. Poorly ventilated buildings where students learned anatomy by dissecting corpses in various states of decay. The smell was indescribable, a mixture of rotting flesh, chemicals used for preservation, and the unwashed bodies of students and teachers alike. Disease spread rapidly in these environments, and many medical students died before completing their education. Doctors' offices and clinics were equally unsanitary. There was no concept of sterilization or hygiene. Instruments were used on multiple patients without cleaning. Bloody aprons were worn for days at a time, and the floors were often covered with straw that was changed infrequently and became soaked with blood, pus, and other bodily fluids. The financial aspects of medical practice were equally brutal. Most people couldn't afford proper medical care, so doctors often went unpaid for their services. Those who could pay often did so with goods rather than money: a chicken for a bloodletting, a bag of grain for setting a broken bone. Wealthy patients were charged enormous sums for treatments that were no more effective than those given to the poor, but they were often more elaborate and therefore more dangerous. Doctors frequently found themselves in legal trouble when their treatments went wrong, which was most of the time. Medical malpractice was a constant concern, though the standards for what constituted malpractice were much different than today. A doctor could kill a patient through complete incompetence and face no legal consequences, but if they failed to follow established procedures, no matter how useless or harmful those procedures were, they could be sued, imprisoned, or even executed. The social status of doctors varied wildly depending on their training and clientele. University-educated physicians who served wealthy patients enjoyed considerable prestige. Despite their complete lack of effective treatments, they wore fine clothes, spoke Latin, and were consulted on matters beyond medicine. However, barbers and apothecaries were considered little better than tradesmen, despite often providing more practical help than their educated counterparts. The competition between different types of medical practitioners was fierce and often violent. Physicians looked down on surgeons as crude craftsmen, while surgeons mocked physicians as useless theorists who were afraid to get their hands dirty. Apothecaries were attacked by both groups as unqualified charlatans, despite the fact that their herbal remedies were often the only treatments that provided any real benefit. Women were almost entirely excluded from formal medical practice, though they often served as midwives and herbalists. These women frequently had more practical knowledge about healing than university-trained physicians, but they were constantly under suspicion of witchcraft. Any woman who showed too much skill in healing arts risked being accused of making pacts with the devil, leading to imprisonment, torture, and execution. The role of religion in medicine cannot be overstated. Most doctors believed that disease was fundamentally a spiritual problem, either caused by sin or sent as a test by God. This led to treatments that focused more on the patient's soul than their body. Prayer was considered an essential component of any medical treatment, and patients who failed to recover were often blamed for insufficient faith rather than inadequate medicine. Plague. Doctors deserve special mention as perhaps the most iconic and terrifying figures in 17th century medicine. These men, who specialized in treating victims of the bubonic plague, wore distinctive leather outfits that covered them from head to toe, including the famous bird-like masks with long beaks. The beaks were filled with aromatic herbs and spices that were believed to purify the air they breathed, protecting them from the miasma, or bad air that was thought to cause the plague. The reality of being a plague doctor was a nightmare beyond imagination. They walked through cities where corpses rotted in the streets, where entire families died behind locked doors, and where the very air seemed thick with death. Their leather outfits were hot, uncomfortable, and provided no real protection against the disease. Many plague doctors died within weeks or months of taking up their positions, but the job paid well enough that there were always desperate men willing to take the risk. The treatments provided by plague doctors were useless at best and harmful at worst. They would lance the buboes, the swollen lymph nodes that characterized the plague, releasing floods of infected pus. They prescribed various herbal concoctions and performed bloodletting on patients who were already dying from a disease that attacks the circulatory system. The sight of a plague doctor approaching was often the last thing victims saw before dying. The bubonic plague killed approximately 1/3 of Europe's population during the 14th century, and smaller outbreaks continued to devastate communities throughout the 17th century. Doctors had no understanding of how the disease spread through fleas carried by rats, and their treatments were completely ineffective. They blamed everything from astral configurations to moral failures, leading to persecution of various minority groups who were scapegoated for the epidemic. Surgical specialties, such as they were even more horrifying than general practice. Lithotomy, the surgical removal of bladder stones, was performed by specialists called lithonic surgeons. The procedure involved restraining the patient in a special chair, making an incision in the perineum, and fishing around inside the bladder with crude instruments until the stone could be grasped and pulled out. The mortality rate was over 50%, and survivors often suffered from incontinence, infection, and chronic pain for the rest of their lives. Cataract couching, as mentioned earlier, was performed by traveling specialists who would arrive in a town, perform several operations in quick succession, and leave before the results became apparent. These men were often charlatans with no real training, but even legitimate practitioners had success rates that were abysmal by any standard. Dental care was perhaps the most primitive aspect of 17th century medicine. Tooth extraction was performed with crude pliers, often removing pieces of jawbone along with the infected tooth. There was no understanding of dental hygiene or the connection between oral health and overall health. Wealthy people sometimes had their teeth cleaned by barbers, but this often involved scraping with sharp instruments that damaged the enamel and caused more problems than they solved. The pharmacological knowledge of the era was a bizarre mixture of useful herbal remedies and complete nonsense. Willow bark, which contains salicin, a precursor to aspirin, was sometimes used for pain relief, and digitalis from foxglove was occasionally prescribed for heart problems. However, these legitimate remedies were mixed in with treatments like powdered mummy, which was exactly what it sounds like, ground up Egyptian mummies that were believed to have magical healing properties, bezoars. Stones found in the stomachs of certain animals were considered powerful antidotes to poison and sold for enormous sums. Unicorn horn, typically narwhal tusk, was ground into powder and prescribed for various ailments. The rarity and expense of these substances added to their perceived value, but they had no medical benefits whatsoever. The concept of dosage was poorly understood, leading to frequent poisoning from treatments that might have been helpful in smaller quantities. Opium was known and used for pain relief, but doctors had no way to measure doses accurately, leading to frequent overdoses. Similarly, various plant extracts that contained active compounds were often prepared so concentrated that they became toxic. Hospital conditions in the 17th century were so appalling that being admitted to one was often tantamount to a death sentence. Hospitals were overcrowded, unsanitary institutions that served more as places for the poor to die than as centers of healing. Patients with different diseases were crowded together in large wards, allowing infections to spread rapidly. The mortality rate for hospitalized patients was astronomical, not just from their original ailments, but from diseases contracted in the hospital itself. The nursing care, such as it was provided by untrained attendants who were often more interested in stealing from patients than caring for them. Bed linens were changed infrequently, and patients often lay in their own waste for days at a time. The smell of a 17th century hospital ward would have been overwhelming, a mixture of unwashed bodies, infected wounds, human waste, and the various noxious substances used as medicines. Medical education was a lengthy process that involved years of study but provided almost no practical training. Students learned anatomy from ancient texts that were riddled with errors, studied theories that had no basis in reality, and memorized treatments that were actively harmful. Dissection of human bodies was rare and controversial, so most doctors had only a theoretical understanding of anatomy that was often completely wrong. The few medical schools that existed were primarily concerned with teaching students to read and interpret ancient texts rather than to observe and treat actual patients. Students would spend years learning to debate the finer points of humoral theory while gaining no practical experience with actual sick people. When they finally began practicing, they were essentially experimenting on their patients with theories they had memorized but never tested. The economic pressures on medical practitioners were enormous. Most people couldn't afford to pay for medical care, so doctors often worked for free or accepted payment in goods. This meant that only the wealthy could afford the most elaborate treatments, which were ironically often the most dangerous. Poor patients received simpler treatments that were sometimes more effective simply because they were less likely to kill the patient outright. The legal framework surrounding medical practice was chaotic and varied widely from place to place. In some areas, anyone could claim to be a doctor and begin treating patients. In others, strict licensing requirements existed but were often ignored or circumvented, Medical malpractice laws existed, but were rarely enforced, partly because the standard of care was so low that almost anything could be considered acceptable practice. The relationship between doctors and their patients was complicated by the complete lack of effective treatments. Patients often suffered through treatments that were worse than their original symptoms, yet they continued to seek medical care because the alternative, doing nothing, seemed unacceptable. This led to a strange dynamic where doctors were simultaneously respected for their learning and feared for their treatments. The psychological toll on medical practitioners must have been enormous, though it's rarely discussed in historical accounts. Imagine spending your days performing procedures that you knew were agonizing for your patients, prescribing medicines that often made people sicker, and watching most of your patients die despite your best efforts. The few doctors who began to question established practices faced ridicule, professional ostracism, and sometimes persecution for heresy. The superstitions surrounding medical practice were endless and often contradictory. Certain procedures could only be performed during specific phases of the moon, while others required particular astrological alignments. Some doctors refused to treat patients on certain days of the week, while others insisted that medicines be prepared according to elaborate rituals that had no bearing on their effectiveness. The role of magic and supernatural beliefs in medicine was pervasive. Many doctors genuinely believed that they were fighting against evil spirits, curses, and other supernatural forces. This led to treatments that were more exorcism than medicine, involving elaborate rituals, incantations, and the use of various talismans and amulets. The line between medicine and magic was so blurred that it's often difficult to distinguish between them in historical accounts. Women's medicine was particularly influenced by superstition and misogyny. Female anatomy was poorly understood and often described in terms that reflected cultural biases rather than medical observation. Pregnancy and childbirth were surrounded by elaborate taboos and rituals that often interfered with practical care. Menstruation was considered a dangerous condition that could contaminate food, curdle milk, and cause various disasters. The treatment of children was often even more brutal than that of adults. Children were thought to be miniature adults rather than beings with different physiological needs, so they received the same treatments as adults, but in smaller doses. This meant that children were subjected to bloodletting, purging, and various other procedures that were particularly dangerous for their developing bodies. Infectious diseases, which were the leading cause of death in the 17th century, were completely misunderstood. Doctors had no concept of contagion and often spread diseases from patient to patient through their unwashed hands and contaminated instruments. They blamed diseases on everything from bad air to moral failings, leading to treatments that were useless at best and harmful at worst. The Black Death, which had devastated Europe in previous centuries, was still a constant threat in the 17th century. Smaller outbreaks occurred regularly, and doctors had learned nothing from previous epidemics. They continued to prescribe bloodletting and purging for plague victims, often hastening their deaths. The famous plague doctors, with their bird-like masks, became symbols of medical futility rather than healing. Smallpox was another major killer that doctors were powerless to treat effectively. The disease caused horrible scarring in survivors and killed approximately 30% of those infected. Doctors tried various treatments, including bloodletting, purging, and the application of various ointments and poultices, but none of them had any real effect on the course of the disease. Tuberculosis, known then as consumption, was a slow-killing disease that doctors completely failed to understand. They prescribed various treatments, including changes of air, special diets, and various medicines, but none of them were effective. The wasting away of tuberculosis patients was attributed to everything from unrequited love to excessive studying, leading to treatments that were often worse than the disease itself. The working conditions for doctors were often dangerous beyond the obvious risks of disease exposure. Medical practitioners were frequently attacked by relatives of patients who died under their care. They faced constant criticism from religious authorities who viewed their practices as potentially heretical. They were often poor despite their education and social status, living hand-to-mouth existences that were barely better than those of their patients. The tools of the trade were crude and often dangerous in themselves. Surgical instruments were made by blacksmiths and were often little more than sharpened pieces of metal. They were rarely cleaned between uses and became contaminated with blood and tissue from previous patients. The rust and corrosion that accumulated on these instruments added another layer of danger to already risky procedures. Medical books and texts were rare and expensive, often copied by hand and filled with errors. The knowledge they contained was largely based on ancient authorities like Galen and Hippocrates, whose observations were often incorrect and whose theories had been distorted through centuries of copying and translation. Doctors who couldn't afford books relied on oral tradition and personal experience, which was often even less reliable. The social dynamics within the medical profession were complex and often hostile. University-educated physicians looked down on surgeons and apothecaries, while practical healers mocked the theoretical knowledge of academic doctors. Competition for patients was fierce, and practitioners often spread rumors about their competitors, or sabotaged their treatments. Professional jealousy and rivalry were common, making cooperation and knowledge-sharing difficult. The relationship between medicine and religion was particularly complicated. The Church officially supported medical practice as a form of Christian charity, but it also viewed certain treatments and theories as potentially heretical. Doctors had to be careful not to contradict religious teachings in their practice, even when their observations suggested that those teachings might be wrong. This created a constant tension between empirical observation and religious doctrine. The concept of medical ethics, as we understand it today, simply didn't exist. There was no informed consent, no consideration of patient autonomy, and no systematic attempt to balance benefits and risks. Doctors felt free to experiment on patients without their knowledge or consent, often trying dangerous new treatments simply to see what would happen. The welfare of the patient was secondary to the doctor's curiosity or desire for fame. The preservation of medical knowledge was haphazard at best. Important discoveries were often lost when their discoverers died, and there was no systematic way to share information between practitioners. Medical schools were few and far between, and most doctors learned through apprenticeships where knowledge was passed down orally and often incompletely. The diagnostic process was elaborate but completely unreliable. Doctors would spend hours examining patients using techniques that revealed nothing useful about their condition. They would study the patient's complexion, examine their tongue, feel their pulse in dozens of different ways, and analyze their urine, all while ignoring obvious symptoms and signs that might have actually helped them understand what was wrong. The treatment of trauma and injuries was particularly primitive. There was no understanding of wound care, no knowledge of antiseptics, and no effective pain relief. Soldiers wounded in battle often died not from their original injuries but from the infections that developed after their wounds were treated by army surgeons. Broken bones were set without any understanding of anatomy. often leaving patients crippled for life. The practice of bloodletting reached such extremes that some patients were bled multiple times per day for weeks at a time. The theory was that removing bad blood would allow good blood to replace it, but the reality was that patients were being systematically weakened until they died from blood loss, rather than their original ailment. George Washington, who died in 1799, was reportedly bled of nearly half his blood volume in a single day during his final illness. The understanding of nutrition and its relationship to health was almost non-existent. Doctors prescribed elaborate diets based on humoral theory rather than any understanding of vitamins, minerals, or basic nutritional needs. Scurvy, caused by vitamin C deficiency, was common among sailors and others with limited diets. But doctors had no idea that the solution was as simple as eating fresh fruits and vegetables. The treatment of mental illness was perhaps the cruelest aspect of 17th century medicine. Patients with depression, anxiety, or other psychological conditions were often subjected to treatments that would be considered torture by modern standards. They were chained in dark rooms, subjected to cold water treatments, purged with violent medications, and sometimes beaten in the belief that physical pain would drive out mental anguish. The few attempts at surgical innovation were often disastrous. Doctors would try new procedures based on theoretical considerations rather than careful study and practice. The results were usually catastrophic, but the lack of systematic record-keeping meant that the same mistakes were repeated over and over again by different practitioners. The relationship between doctors and death was intimate and constant. Most medical practitioners saw more patients die than recover, yet they continued to practice with the confidence of men who believed they were fighting against forces beyond human understanding. The psychological mechanisms that allowed them to continue in the face of such consistent failure must have been complex and deeply ingrained. The economic structure of medical practice meant that the wealthy received more elaborate and therefore often more dangerous treatments, while the poor received simpler care that was sometimes more effective. This created a paradoxical situation where poverty might actually improve your chances of surviving an illness, since you couldn't afford the expensive treatments that were most likely to kill you. The training of medical practitioners was so divorced from reality that newly qualified doctors were often more dangerous than complete quacks. They had spent years learning theories that were wrong and techniques that were harmful, and they applied this knowledge with the confidence that comes from extensive education. A village-wise woman with no formal training was often a safer choice than a university-educated physician. The preservation of specimens and the study of pathology were nearly impossible given the lack of preservation techniques and the taboos surrounding the handling of dead bodies. This meant that doctors had little opportunity to learn from their failures or to understand what their treatments actually did to the human body. Autopsy was rare and controversial, so the internal effects of medical treatments remained largely unknown. The communication between medical practitioners was limited and unreliable. Important discoveries might take decades to spread from one region to another, and they were often distorted in the process. There were no medical journals, no standardized training programs, and no systematic way to share knowledge. Each doctor was essentially working in isolation, repeating the mistakes of his predecessors and contemporaries. The tools for measuring and monitoring patients were primitive or non-existent. There were no thermometers, no blood pressure cuffs, no stethoscopes, and no way to measure most vital signs. Doctors relied on crude observations and subjective impressions that were heavily influenced by their theoretical preconceptions. The lack of objective measurements meant that the effects of treatments could not be accurately assessed. The understanding of pain and its management was rudimentary at best. Opium was known and sometimes used, but dosages were unreliable and the drug was expensive and often adulterated. Most patients simply had to endure whatever pain their treatments caused, leading to trauma and shock that often proved fatal even when the underlying procedure was successful. The practice of medicine in the 17th century was in essence an elaborate system of ritualized harm performed by well-meaning practitioners who had no understanding of the human body, no effective treatments, and no way to measure the results of their interventions. It was a profession that combined the worst aspects of ignorance, superstition, and misplaced confidence, creating a perfect storm of medical incompetence that killed more people than it helped. The legacy of this era serves as a sobering reminder of how far we've come and how recently we've acquired the knowledge that we now take for granted. The next time you visit a doctor, take a moment to appreciate the antiseptic environment, the effective medications, the accurate diagnostic tools, and most of all, the vast body of scientific knowledge that makes modern medicine actually capable of healing rather than harming. The doctors of the 17th century were not evil men. They were trapped in a system of knowledge that was fundamentally flawed, working with tools that were inadequate and facing diseases that they had no hope of understanding, much less curing. The training that doctors received was not just inadequate, it was actively harmful to their ability to heal. Medical students spent years memorizing the works of ancient authorities, particularly Galen, whose anatomical observations were based on dissections of animals rather than humans. This meant that the foundational knowledge of human anatomy was fundamentally wrong from the start. Students learned that blood was manufactured in the liver, that the heart had holes in it to allow blood to pass from one side to the other, and that women had fewer teeth than men, claims that could have been disproven by simple observation, but were accepted as gospel truth. The few medical schools that existed were more concerned with maintaining tradition than discovering truth. Students who questioned established doctrine were punished or expelled, creating a system that actively discouraged the kind of critical thinking that might have led to medical progress. The result was generations of doctors who were trained to ignore their own observations in favor of ancient texts, no matter how obviously wrong those texts might be. The apprenticeship system used to train surgeons and apothecaries was somewhat better in that it provided hands-on experience, but it also perpetuated dangerous practices and superstitions. Young apprentices learned to perform procedures by watching their masters, copying their techniques without understanding the underlying principles. Mistakes and misconceptions were passed down from generation to generation, becoming more entrenched. With each repetition, the examination system for medical practitioners was a farce. Candidates were tested on their ability to recite classical texts and engage in theoretical debates, rather than their practical skills or knowledge. A student could become a licensed physician without ever having successfully treated a single patient, while a practical healer with years of experience might be barred from practice because they couldn't quote Galen in the original Greek. The continuing education of medical practitioners was virtually non-existent. Once a doctor completed his training, there was no systematic way for him to learn about new developments or improve his skills. Medical knowledge stagnated for centuries because there was no mechanism for progress or innovation. Doctors who had been practicing for decades continued to use the same ineffective treatments they had learned as students, regardless of their obvious failures. The geographical isolation of many medical practitioners meant that they worked in complete intellectual isolation. A doctor in a remote village might go years without speaking to another medical professional, relying entirely on his own limited knowledge and experience. This isolation prevented the sharing of information and made it impossible for beneficial innovations to spread. The political aspects of medical practice added another layer of complexity and danger to an already hazardous profession. Medical practitioners were often caught between competing authorities: the church, secular governments, and professional guilds, each with their own requirements and restrictions. A treatment that was acceptable to one authority might be considered heretical or illegal by another, leaving doctors in impossible positions. The regulation of medical practice varied wildly from place to place and was often contradictory or unenforced. Some regions had strict licensing requirements that were rigorously enforced, while others allowed anyone to practice medicine regardless of their qualifications. This created a chaotic situation where patients had no way of knowing whether their doctor was a university-trained physician or a complete charlatan. The guild system that governed many aspects of professional life in the 17th century created additional problems for medical practitioners. Guilds were more concerned with protecting their members' economic interests than with maintaining standards of care. They often restricted the number of practitioners who could work in a given area, creating artificial scarcity that drove up prices while limiting access to care. The legal framework surrounding medical practice was primitive and often counterproductive. Medical malpractice laws existed but were rarely enforced, partly because the standard of care was so low that almost any treatment could be considered acceptable. When doctors were prosecuted for malpractice, it was often for failing to follow established procedures rather than for harming their patients, which meant that dangerous but traditional treatments were legally protected, while innovative but unproven approaches were discouraged. The insurance and liability systems that might have encouraged safer practices simply didn't exist. Doctors bore no financial responsibility for the harm they caused, which removed any economic incentive to improve their practices. Patients who were harmed by medical treatment had little recourse, especially if they were poor or socially marginal. The military medical system was particularly horrifying and deserves special attention. Army surgeons were often the least qualified medical practitioners, men who couldn't establish successful civilian practices and turned to military service as a last resort. They were expected to treat horrific battlefield injuries with the same primitive tools and useless theories used in civilian practice, but under even worse conditions. Field hospitals were essentially charnel houses, where wounded soldiers were brought to die. The mortality rate for wounded soldiers who received medical treatment was often higher than for those who were left untreated, partly because of the infections spread by contaminated instruments and unwashed hands. Army surgeons would move from patient to patient without cleaning their tools, spreading gangrene and other infections throughout the hospital. The amputation of limbs was the most common surgical procedure performed on wounded soldiers, and it was done with shocking brutality and incompetence. Surgeons would saw through bones with carpenter's tools, cauterize wounds with red-hot irons, and then move on to the next patient without any follow-up care. The survival rate for battlefield amputations was perhaps 20%, and survivors often died slowly from infection or shock in the days following surgery. The treatment of gunshot wounds was particularly primitive. Doctors believed that gunpowder created a unique type of poisoning that required special treatment, leading to procedures that were often more harmful than the original wound. They would probe wounds with dirty instruments, pour boiling oil into them to cleanse the poison, and pack them with various substances that promoted infection rather than healing. The Naval Medical Service was, if possible, even worse than its military counterparts. Ships' surgeons were often drunk, incompetent, or both, and they had to work in cramped, unsanitary conditions below deck. Sailors who were injured aloft or in battle faced the choice between certain death from their injuries or probable death from their treatment. Scurvy was a major killer among sailors, though doctors had no understanding of its cause or treatment. They prescribed various useless remedies, while the simple solution, fresh fruits and vegetables, remained unknown. Entire ships' crews would die from scurvy while carrying cargo that could have saved their lives. If anyone had understood the connection between diet and disease, the treatment of tropical diseases encountered during exploration and colonization was completely hopeless. European doctors had no experience with malaria, yellow fever, dysentery, and other tropical ailments, so they applied their usual arsenal of bloodletting, purging, and mercury with predictably disastrous results. The mortality rate among European colonists and sailors in tropical regions was astronomical, often approaching 100% for certain expeditions. The interaction between European medicine and indigenous healing practices was characterized by arrogance and missed opportunities. European doctors dismissed native healing methods as primitive superstition, even when those methods were demonstrably more effective than European treatments. The result was that potentially valuable medical knowledge was lost or suppressed in favor of useless European theories. The pharmaceutical industry of the 17th century was a maze of fraud, superstition, and dangerous experimentation. Apothecaries mixed elaborate compounds based on astrological considerations, ancient recipes, and pure guesswork. The lack of standardization meant that the same medicine might vary wildly in potency and composition from one batch to the next, making dosing impossible and poisoning common. The importation of exotic drugs and ingredients from distant lands created a thriving trade in medical curiosities that were often worthless or harmful. Rhinoceros horn, tiger bones, exotic plant extracts, and various mineral preparations were sold at enormous prices to wealthy patients who believed that rarity equaled effectiveness. The more expensive and exotic a remedy was, the more faith people placed in its healing powers. The preparation of medicines was often as dangerous as the diseases they were meant to treat. Apothecaries worked with toxic substances like mercury, lead, arsenic, and antimony without any understanding of their dangers. They heated, distilled, and combined these substances in ways that often increased their toxicity, creating medicines that were essentially elaborate poisons. The dosing of medicines was entirely guesswork, with potentially fatal consequences. There were no standardized measurements, no understanding of body weight considerations, and no concept of therapeutic versus toxic doses. Patients might receive a harmless amount of a potentially beneficial substance or a lethal dose of the same compound, depending entirely on the whims and errors of their doctor. The storage and preservation of medicines was primitive, leading to degradation and contamination that made already dangerous substances even more hazardous. Medicines were often stored in unsanitary conditions where they could be contaminated by insects, rodents, and various bacteria and fungi. The resulting preparations were frequently more dangerous than no treatment at all. The veterinary medicine of the era provides an interesting contrast to human medicine and reveals just how misguided human medical practice had become. Animals were often treated more effectively than humans because veterinarians were forced to focus on practical results rather than elaborate theories. A horse or cow that didn't recover from treatment represented a significant financial loss. So veterinary medicine developed along more pragmatic lines. Interestingly, some of the most effective medical treatments of the era were borrowed from veterinary practice. Wound care techniques developed for horses were sometimes more advanced than those used on humans, and certain surgical procedures were performed more skillfully on animals than on people. This suggests that human medicine was held back not by lack of capability but by adherence to useless theoretical frameworks. The treatment of animals also reveals the class-based nature of medical care. Valuable horses belonging to wealthy owners received better medical attention than poor humans, highlighting the economic factors that determined the quality of care. A nobleman's horse might see a skilled veterinarian, while his servants were treated by incompetent quacks. The psychological aspects of medical practice in the 17th century were complex and often counterproductive. The elaborate rituals and ceremonies surrounding medical treatment were designed to inspire confidence in patients, but they often served mainly to hide the doctor's ignorance and incompetence. The more uncertain a doctor was about his treatment, the more elaborate and theatrical his presentation became. The placebo effect was probably the only genuinely beneficial aspect of many medical treatments. Patients who believed in their doctors' abilities might experience some temporary improvement, though this was usually overwhelmed by the harmful effects of the actual treatments. The psychological comfort provided by medical attention may have been the only real benefit that most patients received. The relationship between doctor and patient was fundamentally different from modern practice. Doctors were authority figures who expected complete obedience from their patients, while patients were expected to submit passively to whatever treatments were prescribed. There was no concept of informed consent or patient autonomy. Doctors made all decisions without consulting their patients or explaining the risks and benefits of treatment. The communication between doctors and patients was often deliberately obscure. Doctors spoke in Latin or used technical terminology that patients couldn't understand, partly to maintain their authority and partly to hide their own ignorance. Patients were not expected to ask questions or participate in decisions about their own care. The emotional toll on patients and their families was enormous. Watching a loved one undergo medical treatment was often more traumatic than watching them die from their original illness. The screams of patients undergoing surgery without anesthesia, the sight of blood flowing during therapeutic bleeding, and the obvious suffering caused by various treatments created lasting psychological trauma for everyone involved. The social stigma associated with certain diseases added another layer of suffering to medical practice. Syphilis, mental illness, and various other conditions were seen as moral failings rather than medical problems, leading to treatments that were designed as much to punish as to heal. Patients with these conditions faced social ostracism in addition to their physical suffering. The role of family members in medical care was both crucial and problematic. Families were expected to provide nursing care and assist with treatments, but they had no training and often made things worse through well-intentioned but harmful interventions. The emotional stress on family members watching their loved ones suffer through useless treatments was enormous. The economic burden of medical care fell heavily on families who were often already struggling financially. The cost of elaborate treatments could bankrupt a family, while the loss of the primary breadwinner to illness or ineffective treatment could lead to destitution. Many families faced the choice between seeking medical care and maintaining their economic survival. The seasonal patterns of disease and medical practice added another dimension to the challenges faced by 17th century doctors. certain diseases were more common in specific seasons, but doctors had no understanding of the environmental factors that influence disease patterns. They attributed seasonal variations to astrological influences rather than practical considerations like nutrition, sanitation, or weather. Winter was particularly deadly, not just because of increased disease rates, but because medical treatments became even more dangerous. Cold weather made surgery more difficult and dangerous, while heating methods created fire hazards and indoor air pollution that worsened respiratory conditions. The lack of fresh food in winter led to nutritional deficiencies that were completely misunderstood by medical practitioners. The summer months brought their own challenges, including increased rates of infectious disease due to poor sanitation and contaminated water supplies. Doctors had no understanding of the connection between heat, sanitation, and disease, so their treatments remained the same regardless of seasonal considerations. The urban-rural divide in medical practice was stark and revealing. Urban doctors had access to more elaborate equipment, exotic medicines, and colleagues for consultation, but they also had higher rates of treatment failure due to their adherence to complex theoretical systems. Rural practitioners were often less educated but more pragmatic, sometimes achieving better results through simpler approaches. The availability of medical care varied enormously between urban and rural areas. Cities might have multiple doctors competing for patients, while rural areas might have no qualified medical practitioners for hundreds of miles. This geographic inequality meant that access to medical care, however ineffective, was largely determined by where one lived. The transportation of seriously ill patients to receive medical care was often more dangerous than the original illness. Patients might be carried for days over rough roads to reach a doctor, arriving in worse condition than when they started. The stress and trauma of travel often proved fatal to patients who might have recovered if left alone. The seasonal migration patterns of some medical practitioners added another complication to healthcare access. Some doctors followed wealthy patients to their country estates or traveled circuit routes that left certain areas without medical care for months at a time. This irregular availability of care meant that timing could be as important as location. In determining whether a patient received treatment, the international aspects of medical practice were characterized by the same mixture of ignorance and arrogance that defined domestic medicine. European doctors who traveled to other continents brought their useless theories and harmful practices with them, often with devastating results for local populations who had no immunity to European diseases and no benefit from European treatments. The colonial medical system was a disaster that combined the worst aspects of European medicine with the conditional challenges of unfamiliar environments and diseases. Colonial doctors were often the least qualified practitioners, men who couldn't establish successful practices in Europe and sought their fortunes in distant lands. The mortality rates among colonial populations were astronomical, due partly to disease but also to the harmful effects of European medical intervention. The interaction between different medical traditions was a missed opportunity for learning and progress. European doctors encountered sophisticated medical systems in China, India, the Islamic world, and indigenous American cultures, but they dismissed these alternatives as primitive superstition. The result was that potentially valuable medical knowledge was ignored or suppressed in favor of ineffective European methods. The missionary medical work of the period was characterized by good intentions and disastrous results. Missionaries who combined religious instruction with medical treatment often caused more harm than good, spreading disease while providing ineffective care. The association between Christianity and harmful medical practices created lasting suspicion of Western medicine in many parts of the world. The documentation and record-keeping practices of 17th century medicine were so poor that it's often difficult to determine exactly what treatments were used and what their effects were. Doctors kept few records, and those that survive are often incomplete or unreliable. This lack of systematic documentation made it impossible to learn from experience or identify patterns of success and failure. The few medical case studies that survive from this period revealed the shocking disconnect between medical theory and practice. Doctors would describe elaborate diagnostic procedures and complex treatment regimens, but the actual outcomes were rarely recorded or were reported in such vague terms that it's impossible to determine what really happened. The preservation of medical knowledge was haphazard and subject to loss through fire, war, neglect, and deliberate destruction. Important discoveries might be recorded in a single manuscript that could be lost forever if it was damaged or destroyed. The lack of printing and distribution systems meant that medical knowledge remained localized and fragmented. The translation of medical texts from one language to another introduced additional errors and distortions. Medical knowledge that might have been relatively accurate in its original form became increasingly corrupted as it passed through multiple translations and copies. The result was that doctors often worked with information that bore little resemblance to the original observations. In the end, perhaps the most tragic aspect of 17th century medicine was not the suffering it caused, but the fact that the practitioners genuinely believed they were helping their patients. They went to their graves convinced that they had spent their lives in the noble pursuit of healing, never realizing that they had actually been merchants of misery, dealers in pain, and unwitting angels of death. The combination of absolute confidence and complete ignorance that characterized the medical profession of this era serves as a sobering reminder of how wrong we can be when we fail to question our assumptions and test our beliefs against reality. The legacy of this dark period in medical history extends far beyond the immediate suffering it caused. The systematic suppression of observation and critical thinking in favor of ancient authority created intellectual habits that persisted long after better knowledge became available. The hierarchical and authoritarian structure of medical practice established patterns of professional behavior that were slow to change, even as medical knowledge improved. It was without question one of the worst times in human history to be either a doctor or a patient. A dark chapter in the long struggle to understand and heal the human body that we are still writing today. The doctors of the 17th century were not evil men. They were trapped in a system of knowledge that was fundamentally flawed, working with tools that were inadequate and facing diseases that they had no hope of understanding, much less curing. Their story serves as both a cautionary tale about the dangers of unquestioned authority and a reminder of how precious and hard-won our modern medical knowledge truly is.